The NHS is facing a shocking epidemic of sexual misconduct and violence that affects staff and patients alike. But what are the gaps and challenges in the current policies, procedures, and practices to prevent, manage, and respond to this problem? One of the main challenges is the lack of dedicated policies on sexual safety in most NHS trusts. According to an investigation by The Guardian and the BMJ, only 23 out of 207 trusts that responded to a Freedom of Information request had a specific policy that covers how to safeguard staff, patients, and visitors from sexual harm, and what processes to follow when cases are reported. This means that most trusts rely on a range of policies that cover some aspects of sexual safety, such as managing violence or safeguarding children and adults, but do not address the specific needs and risks of sexual misconduct or violence. Another challenge is the underreporting of sexual misconduct incidents, especially by staff. The same investigation found that NHS trusts recorded more than 35,600 cases of sexual safety incidents between 2017 and 2022, but experts estimate that more than 100,000 incidents a year are not being captured in the annual figures. This is partly because trusts are no longer obliged to report abuse of staff to a central database, and partly because staff may fear retaliation, stigma, or lack of support if they report their experiences. As a result, many cases of sexual misconduct go unreported and uninvestigated, leaving perpetrators unpunished and victims unsupported. A third challenge is the inadequate training and support for staff and patients on how to deal with sexual misconduct or violence. Many staff do not receive adequate education on how to recognize, prevent, and respond to sexual misconduct in the workplace, or how to support patients who disclose their experiences. Similarly, many patients do not receive clear information on their rights and options when they experience sexual harm in the NHS, or how to access support services. This creates a culture of silence and tolerance that allows sexual misconduct to persist and escalate. A fourth challenge is the inconsistent data collection and analysis on sexual misconduct or violence in the NHS. There is no standardized definition or classification of sexual safety incidents across trusts, making it difficult to compare and monitor trends and patterns. There is also no centralized system to collect and analyze data on sexual misconduct or violence, which limits the ability to identify risk factors, evaluate interventions, and measure outcomes. This hampers the development of evidence-based policies and practices that can effectively prevent, manage, and respond to sexual misconduct or violence in the NHS. These are some of the gaps and challenges that need to be urgently addressed if the NHS wants to tackle the shocking problem of sexual misconduct or violence that affects its staff and patients. The NHS needs to adopt a zero-tolerance approach to sexual harm and implement comprehensive policies, procedures, and practices that can protect everyone from this serious threat to their safety, dignity, and well-being.